Today I thought we'd talk about rectal bleeding. So what is rectal bleeding? It's basically when you have blood coming out from the rectum. Now, when this happens, first of all, it could be from something very basic, such as hemorrhoids or a fissure, or it could be something more than that, like some sort of inflammation or a polyp or whatever. So first of all, we need to know if it's one-time thing, if it happens regularly, if it's of a small amount, large amount, if it's on top of the stool, if it's inside of it. All that gives us information. Also, the age of the patient. So if it's a very young person, then you're not really thinking of bad things, not that it can't happen, and if it's a more elderly patient, then you want to make sure that there's nothing serious going on, obviously. You want to know, first of all, if there's other symptoms associated with this. Is it just a simple bleed, or is it associated with a change in bowel movements? Is it associated with weight loss, abdominal pain, distension, and so forth? So once you get an adequate history, then you want to examine the patient. That's what we would do. And in that examination, it's a full, because everything in the body is connected, so you do a generalized exam. You examine the belly, make sure there's no masses and whatever. But in the rectum, sometimes you can come up with the diagnosis. If there's like a fissure, like a crack in the anal canal, a lot of times you'll be able to feel that on your examination, and there'll be tenderness. And sometimes you can see hemorrhoids as well. So if it's something simple like that, and if it's a young patient, then you may just want to treat that and see what happens. For older patients, you want to be a little bit more careful. So what are some of the causes of rectal bleeding? Well, first, it can be something basic like hemorrhoids. These can be internal or external. It can be an anal fissure, which is like a crack in the anus. It could be an inflammatory process. And here we're talking about something like ulcerative colitis or Crohn's disease. These are chronic disorders. It could be from not enough blood going to the gut, and this can happen with age or with certain medical conditions and also certain medications. So you get what we call an ischemic colitis. Sometimes the bleeding can be from a diverticular, like from one of the pockets that can form in the bowels with time, and these pockets can get infected and sometimes just bleed. It can be from sometimes vessels that just form on their own, and sometimes these vessels form after you get radiotherapy or some other types of disorders. So without going into an exhaustive list, these are some of the conditions that can cause bleeding. Now, what can you do? If it's something simple well, sometimes it's complicated as well, but an internal and external hemorrhoid, you can treat this with what we call supraanal infrared photocoagulation. So long name, but what it is basically is we just apply a certain type of light on top of the hemorrhoids. It just takes a few minutes. There's no pain involved. And usually what happens is over the next week or so, the hemorrhoids just shrink and disappear. Another method is band ligation, where we tie elastics over the hemorrhoids, and over the next several days, they disappear. Surgery is another option, although it's done much less now due to the other mentioned forms of treatment. And you can also try topical ointments initially to see if they make a difference, and usually they contain some small amount of steroids. If it's an anal fissure, there's a special ointment for this. The usual topical ointments usually don't work. In the past, surgery was done for this. However, surgery can have sometimes secondary effects, such as incontinence. Even though rare, it can happen. A form of treatment, especially if it's not very chronic, is with the special type of an ointment where it helps. What it does is, this ointment, it contains a cardiac medication which is diluted, and it improves the blood flow. Because an anal fissure, what happens is you have a fissure which causes a narrowing in the anal canal, and you get decreased blood supply. With the blood supply, you get more of a fissure, which causes more of a stricture, and it's just a process that follows each other. With this ointment, you increase the blood supply, there's relaxation in the anal canal, and usually up to about 80 or more % chance that you will actually heal the anal fissure. If it's an inflammatory process, then there's special treatment for this in conditions like ulcerative colitis or Crohn's. If it's an ischemic colitis, usually it'll improve on its own, same as with diverticular disease. And sometimes if there's little small vessels that are formed, you can burn these with a colonoscopy. And if there's a polyp, it can be removed. And if it's a tumor, then it may need surgery. How can you diagnose this? Well, first, proper examination. You can do, if needed, an ultrasound, a CT scan. But one method that we usually go to, especially if it's a chronic problem, is a colonoscopy. Because with this, it's a light, and you examine the entire large bowel. If there are any polyps, which are formations in the bowel, it can be removed. These formations, bowel cancer usually starts as polyps, but not all polyps turn into cancer. You have risky polyps and you have those that are not. But when we see a polyp on colonoscopy, we remove it. And usually if it's of a small size, large polyps, most of the time we can remove it endoscopically without a problem. If there is some sort of malignancy, then we take biopsies and refer the patient to a surgeon for surgery. But one other thing that colonoscopy helps us do is take biopsies. So with these biopsies, it's looked into under microscopy, and that's where you can make your diagnosis. Sometimes, even if everything looks normal, your biopsies can give you a whole host of information which will be helpful to you. So basically, that's what I wanted to talk about for rectal bleeding, and hopefully we'll see you at another time. Have a great day.